This year's flu season is starting extra hard, so we want to be on the lookout for signs and symptoms. We brought in the expert to talk to us about this, Eric Stanek, the Chief Medical Officer of DoctorsNow here in Des Moines, for today's Hello Health. So thank you so much, Doctor, for coming in and chatting with us. Yeah, this flu season, at least from what I'm hearing in the news, it's kind of crazy so far. It's been
a crazy season, and you definitely know it if you work in healthcare.
Yeah.
And there's a good chance you know it if you're in the community at all, because it's around the workplace, it's around the homes, whether people know it or not. But usually influenza makes itself known to people because the symptoms can be pretty severe.
So some of the rumblings I've heard is that this strain that's spreading, it may not actually be in the flu shot strain. Is that accurate?
It depends on who you ask.
Okay.
The most recent data from the CDC shows that this year's flu strain is what they call a mild to a moderate match.
Okay.
So the flu vaccine is based off of predictions about what virologists think the dominant strain is going to be. Oh yeah,
and
we know all about predictions with the weather. It's the same sort of idea as that. And overall, this year the benefits of the flu shot seem to outweigh the risk in pretty much everybody. So our advice is, if you haven't had the flu this year, then you're probably better off getting the flu shot.
Right, just at least cover that base, give a little extra protection.
Yeah.
So are there particular signs and symptoms with this round of the flu that stand out compared to other years, or is it still the typical?
It's still your typical flu-like symptoms, right? And so flu is a respiratory virus, just like many other, cold viruses, like your coronaviruses, adenovirus, parainfluenza, and viruses like that. But those tend to cause less severe symptoms. Cough, congestion, maybe a sore throat, maybe a fever, but people know that stuff as a cold, right? Flu-like symptoms are more severe. There's a lot of inflammatory symptoms like high fevers, bad headaches, nausea and vomiting, muscle aches, profound fatigue. These things make themselves known, and they often come all at the same time within a 24 to 48 hour period, and that's why people say all the time, I feel like I got hit by a bus, I got hit by a truck, stuff like that.
Yeah, it's really interesting the times in the past where I've had the flu. I feel like, 3 hours earlier in the day I was fine, and then the next thing I knew, I had a fever and I was not feeling well. It just came on really quick.
Yeah, and being able to recognize those signs and symptoms is really important for families, because we have our walk-in urgent care over at DoctorsNow. It's open 7 days a week, and we're open 8 a.m. to 8 p.m. And getting in early is an important part of reducing complications from influenza, like pneumonia, or even shortening the course of the disease by being able to get people some anti-inflammatory medicine or some targeted medicine against the flu to slow viral replication.
Right. So do you, if somebody were to come in with these symptoms, do you test for the flu at DoctorsNow?
Yep, we test. We have point of care testing on the spot. It takes about 15 minutes from the time we get the nasal swab to the time that we put it into the machine. We don't have to go all the way back in the nose and tickle people's brains. People probably remember those times from the early COVID days. It's just a simple nasal swab. People tolerate it just fine. We get people results, and we're seeing like over 30% of the flu swabs that we run in clinic do come back positive for influenza. Usually influenza A, sometimes influenza B, but the influenza A is the dominant strain.
Yeah, I've heard the percentage is pretty high with those coming back. Does everybody get Tamiflu, or do some people just get sent home to rest in bed with fluids?
It depends. So the way Tamiflu works is it blocks viral replication of influenza. So ideally you come in within 24 to 48 hours of symptoms so that we can block some viral replication, getting Tamiflu started as soon as possible before influenza floods your system, so to speak. And then we can help people with symptomatic care too. So I talked about a lot of those inflammatory symptoms that come from influenza. Anti-inflammatory medicines are very effective for that. Some of those are available over the counter. We have strong injectable anti-inflammatory medicines available that help people, it really helps people get through a night without feeling miserable. And then we have medicines to help people with cough, help people with nausea, whatever seems to be bothering people. That's generally the course that we take for people. And of course, we're keeping an eye out for red flag symptoms in the case that people are developing complications like influenza pneumonia. Sometimes, we want to either do what we can to keep people out of the emergency room or appropriately send people to the emergency room if we're concerned for them.
All right, and you do have 3 locations. I know one is right by my house in Johnston, and there's 2 others.
Yep, we have one location over in West Des Moines off 50th and Mill Civic, and the other is over in Altoona on 8th Street.
And you don't have to be an established patient or anything like that to
Nope.
just stop by.
You can schedule an appointment using the website or calling in any of our locations. Or you can just walk in. We have a walk-in clinic. We're open 7 days a week, 12 hours a day.
Perfect. I love that. We have used DoctorsNow in our family, so thank you.
Awesome. Thank you.
Well, to learn more, go to doctorsnow.com or call 515-270-1000, 1000. They have locations, as we just mentioned, in Altoona, Johnston, and West Des Moines, and if you can follow them on social media as well.